Hi, my name is Dr. Ross Hauser. Welcome to Caring Medical Florida. I have one of our great clients here, Patti, who came in with an unusual presentation today in that she had kind of an unusual swelling of her wrist, and then her left hand was going numb. So she had symptoms compatible with carpal tunnel syndrome, which we did document by ultrasound. But when we looked at the normal side, she actually has a bifid median nerve, which means that the median nerve, instead of being together, it bifurcates. So I wanted to show that on ultrasound. And then also, Patti's a good illustration of how wrist instability causes carpal tunnel syndrome. So the carpal tunnel is just a bony tunnel through which the median nerve goes. And the question is, why do people get carpal tunnel? Like, why do they get narrowing or compression of the median nerve in this tunnel? Well, it's a bony tunnel. So if you have looseness of the bones in the wrist, you have wrist instability, the bones are moving too much, then obviously when she does certain movements and she gets tingling or numbness when she does this or she does this, so in other words, with those movements, the tunnel is getting narrowed. If you have ligament injury, it'll narrow the carpal tunnel, and then you'll get compression of the median nerve. Also, if you have wrist instability, it can cause a ganglion cyst or a cyst to form on the back of the wrist. So her wrist instability is causing carpal tunnel and also a ganglion cyst. The median nerve in the wrist normally stays together, but we see on this ultrasound in Patti's right wrist that it's actually been divided. So here's the two branches of the median nerve. So a bifid median nerve occurs in anywhere from like 3% to 20% of the population. I kind of use about 5%. In her, this branching of the median nerve isn't causing any problems. Because the nerve is getting compressed, she gets numbness and pain mostly at night, but it's starting to come during the day. And I'm going to show an ultrasound picture of her swollen median nerve. She meets the criterion for carpal tunnel syndrome, and the treatment of choice for this is going to be stabilization of her wrist with prolotherapy, which we'll do. We will drain the cyst, and then I'm going to do nerve release in the carpal tunnel, which is also called hydrodissection. So I'm actually going to free the nerve up, and this might have to be done a few times, but the prognosis is excellent for a full recovery, though it is going to take some time to get this muscle strength back and the muscle to be built back up again.